Hi, my name is Mira Bihari. I am a pediatrician and adolescent medicine specialist. I have been doing this little series here on my business website and channel, Adolescent Medicine Consulting, because I want you to know a little bit more about adolescent medicine, who we are, what we do, all of the wonderful things. And if you've been following along, you know that in the first video we talked a little bit about how one becomes an adolescent medicine specialist and what one is. Then we talked about our why, our motivation. Why are we doing what we do, working with teens and young people to make sure that they grow and blossom into wonderful, healthy adults. Today, I want to talk a little bit about the where of where we are. Thinking back to, the school, the who, what, when, where, how, why. I figured we'd talk about where adolescent medicine docs tend to exist. So as you know, we are physicians, we've done medical school, we completed residency in either pediatrics, internal medicine, or family medicine, went on to do a fellowship in adolescent medicine, and now we're out in practice. So with all that education, you can imagine we're probably are going to be in the places where most of that education happens. So today we are on the American Board of Pediatrics website. For those of you who are pediatricians, you are very familiar with this website. And as you may know, they have a variety of different levels of research, some of it, a lot of it, on the field. And they started breaking down where we are by specialty a few years back, and I think it's really great and helpful when we talk about resources for individual states, counties, all of that, as well as the country as a whole. So this website that we're looking at from the American Board of Pediatrics breaks down pediatric subspecialists, and it could be any pediatric subspecialist, by where they are in the country. And we're looking at subspecialists age 70 and under. So as you can see, for those of us in adolescent medicine, there's about 750 board certified adolescent medicine docs practicing throughout the United States. The average number per state, and this is the averages, is 14.4 of us. Sounds pretty good, right? And when we look at what that works out to, that's about one of us per every 100,000 children. The problem is a lot of us are concentrated in the places where we received our medical education. And if you think about it, after all that medical education, probably wanted to settle down in the area where you trained. You probably got married, you may have some kids, it's really hard to pull them out of school and go somewhere else. And, these are also the more densely populated areas of the country. So we've got 95 adolescent medicine docs in the great state of New York, and 25 in the great state of Florida, 44 in Texas, 60 out here in Pennsylvania, also a place with lots of medical education opportunities, 50 over there in Massachusetts. Great place for medical education. So if you look at how many adolescent medicine docs that is per 100,000 children under age 18, that's 3.67 according to what the ABP is telling us. And that would be about 27,000 children per pediatrician. Still a lot for the adolescent medicine specialist, but I think manageable. So California, big state, where there is about one adolescent medicine specialist per 100,000 children. And that seems kind of maybe a little bit more manageable. Don't think so? I don't know if I can handle a panel of 100,000 patients. Then you get out to some places where there are 0 adolescent medicine board certified specialists. And places like Nebraska and Kansas, where there is less than one adolescent medicine specialist per 100,000 children. So when we look at that, we want all of our pediatricians to know something about adolescent medicine. And the folks that are in charge of medical education, the ACGME, they have some guidelines about how programs should teach adolescent medicine and what should be the basics that every resident in pediatrics gets. The challenge is that not all programs are created equal, and some programs are more heavily focused on eating disorder treatment, some are more heavily focused on sports medicine, some are more heavily focused on reproductive health or research. So what the residents learn is tailored to that environment and what the needs are of that community, which could be great if you stay in that community, may not be so helpful if you go someplace else that isn't part of that community. And then when you think about like the lone adolescent medicine person out there in Idaho, where there are diverse areas and geography and all of that we have to deal with, same as in Texas, large expanses where there's absolutely no adolescent medicine doc, this really makes you wonder and think about how we can make sure all young people are getting the services that the ACGME wants us to provide, that the ABP wants us to provide. That's where adolescent medicine consulting comes in. We can help fill in some of those gaps that might have occurred in training. For some folks, they never got any adolescent medicine training at all if they trained before the ACGME mandated some training. When you think about it, if somebody's seeing a family medicine doc, there's no requirement that a family medicine doc has any adolescent medicine training. We are grateful that a lot of our family medicine colleagues are actively working with their organization to teach the residents and their colleagues a little bit more about adolescent medicine and the principles, but the reality is there's no requirement that they have to do a rotation in adolescent medicine. Same thing for our internal medicine colleagues. So all this to say that even though your teen might be seeing a doctor, they may not be seeing somebody who's an adolescent medicine specialist. And if they are seeing an adolescent medicine specialist, they may not be seeing someone who's specifically focused on whatever issue they're presenting with. They might be seeing someone who's a bit more focused on reproductive health care, but they've got an eating disorder and they still need to travel quite a bit to get the care and services they need. So where does this leave us as we're focused on the where question? Well, we all are a small, close-knit group, since there's only about 750 of us actively in practice. And I can tell you that wherever you are, if we can't help you with a specific issue as an adolescent medicine issue, if that's not our area of focus as an adolescent medicine physician, we will help you find a colleague, whether it's within adolescent medicine or in another specialty, to help you have all of your needs met. So I encourage everyone to check out the ABP website. It's kind of fun to play with, whether you're looking at adolescent medicine or gastroenterology, neonatology, developmental behavioral pediatrics. And if you really want to find an adolescent medicine specialist in your area, another website that's great for finding a provider is the Society for Adolescent Health and Medicine website, where there's a Find a Provider tab where you can decide if you want to find a physician, a therapist, a nurse practitioner, a social worker, some specialist in adolescent medicine, and it'll help you figure out where that person is in your community. And again, close-knit groups, so even if somebody's moving somewhere else, we will find someone who can meet your needs. This hopefully was helpful for you, and as we go through the weeks and years together, we'll talk more and more about adolescent health issues and adolescent medicine in general. I hope you'll tune in next time as we delve more into the actual nitty-gritty of adolescent medicine, and I start sharing some of what we do, some of what I do in my practice. And if you'd like more information about adolescent medicine outside of these videos, feel free to check out our website, adolescentmedicineconsulting.com. Give us a call, 254-718-7559. Again, that's 254-718-7559. And definitely send us little messages. We're on Facebook, all of those good things. We want to help you help the teens in your practice. We want to make sure everybody knows at least a little something about adolescent medicine to help spread the word about how we can help. Thank you for your time and attention. Take care.